for connecting to the WHO launch of the guidance on climate resilience and environmentally sustainable healthcare facilities. I think we will start already. Thanks to all of you for connecting. With this, I would like to invite Dr. Maria Neira, who is the Director of the Environment, Climate Change and Health Department in WHO, to provide some opening remarks. Maria, please go ahead. Okay, I think Maria is having some issues to connect. She just got me a message. So we'll give her the floor. Please, can you mute your microphone if you are not speaking? I think I will give the floor to Dr. Diarmid Campbell-Edrون to provide the overall overview of the guidance and the importance of this issue. And then we will give the floor to Dr. Neira as soon as she manages to connect. Diarmid, please go ahead.
Thank you very much, Elena. And welcome to colleagues, welcome to this webinar. Good morning, good afternoon, good evening, depending on where you are in the world. So as Elena has said, what I will do in just 15 minutes or so will be to give a brief overview of the document that we're launching today, its relevance, why we think it's so important, and then hopefully Maria will be able to connect in a few minutes, and we'll be able to give the even more strategic overview. Let me first just check that, as usual, I can show my slides on the screen. So can I just check if you can see the title slide for the presentation?
Yeah, we can see it.
Perfect. And then we just switch to the slideshow. Okay, so the reason that we're launching this guidance is because we know that in order to protect populations from the health risks of climate change, we need to strengthen the whole health system, and even those systems which determine health: water and sanitation, energy, and so on. And the big challenge that we have is that climate change poses such a wide range of risks to health. This is not a single disease like malaria or like dengue or cholera or COVID, where we think, if we can identify the intervention to address that disease, then we can solve it. The ongoing climate crisis is undermining the environmental determinants of health. It's increasing the frequency and intensity of extreme weather events. This is bringing floods, droughts, cyclones to different parts of the world. And in many cases, populations are not just challenged by individual health risks, but they're challenged by combinations of health risks. And so this slide that hopefully you can see at the moment for me, is basically the summary slide of 2020, where we have the COVID crisis overriding almost everything that we're trying to do at the moment in population health, but the other challenges have not gone away. And so at the same time that we have health systems trying to address COVID, we also have extreme weather events. We have wildfires on the west coast of the US. We have cyclones hitting different parts of the world, and so on. So that's part of the reason that we consider that we have to strengthen all of the system, that we can't just deal with these problems individually. Over the years, WHO and PAHO and our partners around the world have started to get quite a lot of experience on what it takes to strengthen health system adaptation, or to health system resilience. So we have been at WHO talking about the health risks of climate change for 30 years now. We published our first report in 1990. But it's only within the last 10 years or so that we've really started to make this into a practical program, to actually work directly with countries on what it takes to protect their populations from the health risks of climate change. So the map that you can see at the moment is every internationally funded project that we're aware of at least $500,000 or more. There's other work going on led by national agencies themselves, particularly in the richer parts of the world. But these are the main ones that we're aware of funded from the international level. And we're involved in many of them, but other partners are also starting to pick these up. So we now have quite a good experience across a diversity of health risks and climate change, and what it takes to build up adaptation and resilience, whether we're talking about heat waves in China, or we're talking about increased risks of vector-borne disease in East Africa, or the problems of water scarcity and flooding in the Pacific. With this project by project, we have to, as I say, take a systems view of this. And so about 5 years ago, we published an operational framework for building climate resilient health systems, which takes those diverse experiences and tries to connect them directly to how health systems people, how our core target audience considers health systems. And so although health systems around the world differ, most will recognize what WHO describes as the building blocks of health systems: leadership and governance, health workforce, information systems, technologies and infrastructure and supplies, delivery programs and financing as the core business of all health systems. And then we have given guidance on how you build climate resilience into, for example, information systems. So how you carry out vulnerability and adaptation assessments for the health risks of climate change, or build climate-informed early warning systems, and so on around these different building blocks. So overall, we promote this system-wide approach to building climate resilience into health systems in order to protect populations. Having said that, even if we're proposing and promoting an overall systems-based approach, we also recognize that the real front line of the health impacts of climate change is healthcare facilities. That's where most healthcare professionals work. It's the main point of contact with almost all communities in terms of receiving health services or protective advice and so on. And we also see that healthcare facilities themselves are challenged, threatened, or even destroyed by the ongoing climate crisis. So the picture here is just one example, but basically it's a health complex in Bangladesh, which has been destroyed by river erosion and severe flooding. And that's just one example of how the ongoing climate crisis raises the risks to healthcare facilities. And also, in our experience with working with countries around the world, they back the systems-based approach, but they also want to know specifically what they should be doing in healthcare facilities, because it's the core inescapable business of health ministries. It's where they spend most of their money and where most of their people are. So we've had a very strong demand for guidance to governments, particularly the health ministry, on how they can do this job of building climate resilience, but also improving the environmental sustainability of healthcare facilities. Because we also know that healthcare facilities have their own environmental impact. The most obvious of that is things like healthcare waste management, but they're also large consumers of resources, or the healthcare in general is a large consumer of resources, and a significant consumer of energy and so on. And so the estimate is that somewhere in between 4 or 5% of global greenhouse gas emissions are now attributable to the healthcare sector globally. So healthcare also has its role in considering how it can reduce its environmental footprint. The guidance that we're launching today is mainly focused, the primary audience is on low and middle income countries, but it also draws on experience from higher income countries. And I think that there are lessons in there as well, which are also relevant across the range of incomes. So what does the guidance try and do? Well, the overall goal, as I basically described already, is to increase the climate resilience of healthcare facilities in order to protect people, protect communities in an unstable and changing climate, but while also giving due consideration to whether we can middle-income countries, encourage them and promote and support them to get on a path to lower environmental footprint, lower greenhouse gas emissions. And in doing this, we recognize that particularly in the poorer parts of the world, the emissions from the healthcare sector are not a large contributor to global greenhouse gas emissions. And yet there are still many things that these facilities can do, which are already good for health, will actually improve healthcare delivery, which will improve resilience and will also be good for the environment as well. And it's also particularly important as lower middle income countries start to invest more in health, the more that they are put on a path to a green development pathways, the better. So I won't read out the objectives that are listed there. You can see them for yourself, but we aim to be quite targeted in speaking mainly to professionals working in healthcare settings, to equip them to anticipate the risks that are coming from climate change, and to give them guidance in terms of protecting the key environmental services that healthcare facilities need in order to protect their populations. And at the same time, as I said, promote environmental sustainability. And as you can imagine, and the people on this call, you work in the sector, you will know that healthcare facilities have a wide range of functions, have a wide range of inputs. We've tried to make this as simple and as practical as possible, so we've basically boiled this down to 4 key blocks that we're mainly focusing on. The first of these, always the most important, is the health workforce, the people that actually make the facility work, that deliver the services. But we've also identified water, sanitation, hygiene, healthcare waste management, energy and infrastructure technologies and products as three other blocks which cover most of what we need to ensure is climate resilient and the areas that we need to promote environmental sustainability within. So just a brief description, this is all presented in the guidance, but as how we see this fitting together. Over on the left-hand side, we have climate change, and we have that expressed through floods, droughts, fires, storms, so on, but also the slowly increasing stress of things like sea level rise, or more frequent droughts or lack of accessibility to water sources. And that impacts on these core functions that healthcare facilities need to provide. And these are the ones in which we're trying to build resilience. These are the functions we're trying to build resilience to these risks over on the left-hand side. And on the right-hand side, we can see that healthcare facilities have environmental impacts. And that's basically what we're trying to reduce. We're trying to reduce the environmental footprint of the operations of healthcare facilities, including all of the supply chain that goes into them. I won't spend a lot of time describing these diagrams. The guidance basically also connects up this focus on healthcare facilities with the overall health system approach. And so this diagram basically takes the one that I showed you earlier for climate resilience within healthcare systems and then focuses in within healthcare facilities on these 4 blocks. But just to show that we're promoting a focus on healthcare facilities within the overall systems-based approach. And basically what we're trying to do, let me just, I'll just in the interest of simplicity, I'll focus just on one of these slides. In general, in terms of protecting populations from health impacts of climate change or protecting services and healthcare facilities, the way that the Intergovernmental Panel on Climate Change represents this is to say that the overall risk to a population or to a system or facility is a function of the hazard. So it's a function of the extent to which you do have heat waves and whether they may be increasing in frequency and intensity, or floods or droughts or chemical spills or anything else that's out there in the environment. That's one determinant of risk. The next is the exposure, so the extent to which those hazards reach the population or the facility that we're talking about. And so in many cases, we're trying to ensure that even though the hazards are out there, the populations don't experience them. And then the final part is the vulnerability. So what are the features of the system that mean that once the population or a facility is exposed, that they suffer or protect the population better? And in all cases, we're trying to shrink these. We're trying to shrink the hazard, we're trying to reduce the exposure, and we're trying to reduce the vulnerability in order to reduce the overall risk. So that's what we mean by trying to build resilience. At the same time, we're also trying to promote environmental sustainability. So we're trying to put healthcare facilities on this path by which they reduce all of those factors that determine risk and also reduce their environmental footprint. Just in the last couple of minutes, I'll just take you through a couple of examples. So we go through these individual blocks. So we say under the health workforce block, there are certain objectives in order to achieve the goal of a health workforce which has the capacity and the knowledge in order to protect populations from these risks. So the first is human resources, and across all of these domains, there is always a need to improve the baseline. In many cases, we don't have enough human resources just in general within healthcare facilities. There may or may not be too much that we can do about that, but it's really important to acknowledge that we need to have enough of these people, of these resources in place. But on top of that, it's also important that the health workforce has the training, the information management system, knowledge management practices that allow them to be informed about these risks and to manage them. So it's one thing to have the people there, it's another to actually provide them with the information that they need in order to know what to do to assess the risk of climate risks or extreme weather events and so on. And they also have a role themselves in communication and awareness raising within the health community, within the healthcare facility, but also out into the wider community. So the guidance introduces the basics of doing this. And to take one more example, that there are these basic environmental services that are absolutely essential to the functioning of any healthcare facility. So water sanitation hygiene should be a minimum requirement for any healthcare facility. And we know that around the world there are too many healthcare facilities which don't even have this basic access, and we would say the same for energy as well. So the first criteria is that that service needs to be in place. But then on top of that, there needs to be consideration of the extent to which the provision of water, sanitation, hygiene and healthcare waste management is threatened by climate change. So if you're in a healthcare facility which is using a water supply and that water supply may be drying up, or it may become contaminated every time it rains, those are the kinds of risks that you need to take into account and to manage if you're going to ensure that you can provide that service and therefore protect the population. So we go through this, I say, for healthcare waste for the health workforce, water, sanitation, hygiene, energy, and then for the technologies, infrastructure and services. And the other thing that the guidance does is to provide some practical tools and checklists that under each of these domains considers both interventions for assessing and improving resilience, but also for improving environmental sustainability. So what can you do in water, sanitation and healthcare waste management in order to ensure that you don't get chemical contamination when there's a flood and get that the waste management part is well taken care of. And then finally, coming to the end, we also make clear within the guidance that this is not a one-off process. This is not something where we invest a certain amount of money and the problem is fixed. It is a continuous process by which we need to establish a baseline to assess the current risks, the current opportunities for improving environmental sustainability. And then there's an iterative process which takes us round to put into place the interventions, to monitor and evaluate them, and to continually repeat this process because the climate is changing, but because the other determinants are changing, and because we also learn as we go along, either within our own practices or learning from others. And then the absolute final point that I wanted to make is just to bring this back to the importance of people. As I said at the beginning, the single most important component of a healthcare facility is the people working within it. And there is a wider role, I would say, in addition to our own practice, and that is acting as advocates within the community, whether that's to inform people about climate risks and how they can protect themselves, or depending on where you are in the world, to also make the case for reduction in carbon emissions and the environmental impact of healthcare services. And the single message in the slide is that the single most trusted voice in pretty much any population around the world are healthcare workers. So the healthcare system, healthcare professionals should never underestimate the weight of their voice, not just in leading by example and doing work within their own practices, but also acting as advocates for increased resilience and low carbon development pathways. So I'll stop there just with the referring you back to the document which is published today, and hand you back to Elena.
Thanks so much, Diarmid. That was an excellent overview and presentation. With this, I'm very happy to let you know that Dr. Maria Neira, the Director of the Environment, Climate Change and Health Department in WHO, is connected. So Maria, please go ahead with your opening remarks.
Thank you, Elena, and thank you, Diarmid, and greetings, dear participants. Good morning, good afternoon, or good evening. Just one message: things need to change. Things need to change, and they need to change in positive, and we cannot keep it the way they are. And what the best way to start this change with a positive approach, and starting by us, by the health sector. I think this guidance will provide plenty of good ideas on how to reduce our own carbon footprint, how to lead by example, how to stimulate the health workers and keeping them stimulated on contributing to this incredible agenda. We will as well reduce air pollution. We will use better all the products that normally we need at the healthcare facilities. And I think we will contribute to this COVID recovery, which is so much needed. So my message to all of you is, of course, thank you so much for your contribution, for your expertise. And now we have the critical mission of promoting it about among our networks, implemented it whenever it's feasible for us, that we are responsible for it, and making sure that this scale up and contribute as much as possible. It's very difficult, very exceptional, so we need to move on something positive, and I think that the movement will start with all of us. So thank you very much, and happy meeting and very successful one. Over.
Thanks so much, Maria, for these energetic words and motivating words. With this, I will give the floor to Dr. Carlos Corbalan, who will be facilitating a panel discussion on initiatives and programs at all levels. Please, Carlos, go ahead.
Thank you, Elena. Good morning, good day, good evening. My name is Carlos Corbalan. I'm going to be facilitating this session. And we have a very interesting mix of persons from around the world. I'm going to read who they are. Diego Moreno Heredia is a specialized professional working on climate change and health at the Ministry of Health and Social Protection of Colombia. We have Esther Pacman, a senior policy advisor from the Ministry of Health, Welfare and Sport of the Netherlands. We have Ashrafeddin Yuya, who's the team leader of climate change and health at the Ministry of Health in Ethiopia. We have Peter Berry, senior policy analyst and science advisor to the Director of Health Canada. Antonella Rizzo from the International Climate and Technical Research Manager, Healthcare Without Harm, a colleague that worked with us, contributing to this guidance as well. And Vera Siejo from the Swedish International Development Cooperation Agency. So welcome, everyone. I'm going to be posing a few questions for you that you had in advance so that we can put some order to the discussion. And So I would like to start calling on Diego and Ashraf-Eddin, and Peter, if you're able to contribute to this one as well, because it has to do with applying the work we've done. So the question is, how is this guidance useful for your area of work or applicable to healthcare facilities in your country? So what I would like is for each one of you to take just a couple of minutes to answer this question, and then because we want to leave a little bit of time at the end, if we can, to open up for discussion. So why don't we start with you, Diego?
Thank you, Carlos. Good morning and good afternoon to all participants. For the presentation. Okay. I think that first of all, I want to tell you that the climate change management is a priority for Colombia. And the process in our country are led by environmental sector, but it's support by the different sectors, including health, including the health sector. We have a national climate change law and a national climate change policy, which establish some commitments that each sector must assume, where the health sector must develop and integrate climate change management plan. In addition, the 2050 long-term strategy for the fulfillment of the Paris Agreement is currently being developed in Colombia. This strategy seeks to guide national, sectorial, and territorial actions to build a climate resilient future in Colombia. Therefore, I think that this guide, the guide for climate resilient and environmentally sustainable health facilities, is an excellent tool for the environment, for the development of our plan. I think that especially to complement the actions we have in the mitigation component of our plan, and maybe to the adaptation. This guide provides us with an operational framework that allows us to review the possible interventions that we can include from those 4 requirements for safe and quality care in the context of climate change that you mentioned in the document: health workforce, water sanitation, hygiene and healthcare waste management, infrastructure, technologies and products, and sustainable energy. And I think that the important thing is to identify in this checklist in the document, identify the interventions that will be most appropriate to our national and regional reality and our context that can be included in our sector and in the long-term strategy for 2050.
Thank you very much, Diego. And what you say is very useful and interesting because, as you say, the guidelines are general. They provide a lot of suggestions on interventions, but something like this can never be complete. So you're quite right that you have to take the elements that are useful for you and complement them with other issues that are of concern to the country or to the local territory where you're working, but it's not necessarily covered in all the interventions in the guidelines. And just to stress on that, we are also going to be very interested in hearing from all of you in the future, the participants, on once you start testing these guidelines, what other interventions should be listed there so that we can have a whole inventory of possible interventions. Thanks very much. I want to continue with Ashraf-Eddin. And someone seems to have the microphone open. If you can open your mics when you're not speaking. But I'll give you the floor now to see how you're working or you're planning to apply, or how applicable is this guidance in your country. Thank you. Dr. Yuria?
Me? Yes. Hello. Can you hear me now?
Please. Yes, we can hear you. Thanks.
Okay. Shall I? Thank you for your invitation and your team. I want to thank all. Yes, it is one of the countries prone to the climate. Hello?
Go ahead, please.
Yes. Okay, thank you. So this guidance is very helpful and applicable in Ethiopia. As you may remember, Ethiopia already developed climate resilient health system criteria, which is going to be implemented at the grassroots level previously before 1 year. So we can implement this guidance by supplementing with our guidance. As you may remember, previously we have health adaptation plan, which is developed before 5 years with stakeholders and supporting partners. So our health facilities are lacking major basic amenities. So this guidance is very helpful in improving, in supplying these necessary amenities, particularly if you take the water. Only 59% of our health facilities has improved water sources. So we have to use this guidance to create the capacities at the health facility level, even including the leadership parts. Even there are energy problem in our health facilities. As you may know, Ethiopia has around 314 hospitals, including specialized and general hospitals. We have 3,678 health centers, which are mediumly implementing and serving the people. We have lower part or the health posts, which is around 17,000. So most of these are without major wash facilities, particularly the water, the sanitation, and related amenities, including electricity. So these guidances will help very much in improving this health facilities management and the major amenities. So even you have major documents, particularly the HNAP, the climate resilience criteria, and we are creating awareness. But in using or in implementing this technical guidance, we have much problem. So this guidance come timely, and it will help us in improving the leadership quality, the wash facilities in the healthcare facilities, and even other related supplies in the health facilities. Apart from that, we have to have skilled manpower, which is aware on the climate change and the related hazards. Even we have to train our personnel on how to treat and how to manage climate related hazards. So these are lacking. So we have to use this guidance in improving the skill of the health facility professionals. Even the other is the management of the health facilities, which we have to work on. So this guidance is very helpful in improving the knowledge, the awareness, and even improving the commitment of all those personnel working around the health facilities and the leadership areas. So we have to even change the maintenance scheme of the health facilities, because the health facilities themselves are under pressure in from the flood or during any internally displaced people pressure. Even in hot areas, these health facilities are lacking the necessary water facility and other related technologies. So to capacitate the preparedness and the early warning system, and to make safe health facilities which are bringing the safe health service to all the customers. Even as you know, there are climate-related diseases in Ethiopia which are emerging and re-emerging currently due to the climatic arenas. You can take cholera, AWD, malaria. The dengue fever is emerged already in some areas. We have a yellow fever in parts of the country. So all these are should be managed when we have capacitated and skilled health facilities. So I think this guidance will help a lot if we use it in supplementing with our already available guidance. If you are hearing me.
Yes, yes. Thank you very much. This is so important. You reminded us of the critical difficulties that some countries, many countries face. They have thousands of healthcare facilities, sometimes trying to struggle having sufficient water or energy. And I'm very glad to hear from you that you find this valuable and important. So in the other spectrum, we have a country like Canada, Peter Berry. You've done some amazing work in Canada, and how useful is still for a country that has done so much already? How useful is it to have this guidance, or do you see that this guidance is mostly to help countries that are still developing their health systems? So I would like to hear from you, Peter. Thanks.
Great. Well, thanks so much, Carlos. Thanks for the invitation to be here and to learn from all of the discussions. And I just want to mention that Health Canada has really benefited greatly from all the work that the World Health Organization has done. I actually see the value in this really important document in terms of sort of the evolution of some of that guidance in developing the knowledge base. So for example, in terms of raising awareness of climate change as an urgent health issue, in some of the guidance that WHO has developed in terms of doing climate change and health assessments, and in developing national adaptation plans. So I think this is a really important report because it allows health authorities to go to the next level to really look at very specific areas, health facilities, climate resilient and environmentally sustainable, and so that's going to really, I think, push the bar in terms of health adaptation significantly, which is going to be great. So in Canada, as in other countries, we're seeing more health impacts from climate variability and climate change, and also learning and documenting impacts on health systems and on health facilities, things like wildfires, floods, heat waves and ice storms. They've impacted facilities and disrupted the provision of care to Canadians during some of the events. And so it is an area of growing concern. So in Canada, we have the Pan-Canadian Framework on Clean Growth and Climate Change. And importantly, this includes actions to protect health, to facilitate health adaptations. So I actually think in the Canadian context, this report is going to be extremely helpful to support a number of activities, particularly related to education and development of practices, tool development for health professionals, mainstreaming climate change, and research and analysis. So for the first one, in terms of sharing best practices, right now Health Canada is leading what we call our Health Adapt initiative, and we're assisting 10 local and regional health authorities to do their own climate change and health assessments. And these are learnings that they can provide to others. So many of these projects are doing broad assessments, but I think are going to be very interested in looking at how can they gauge the resiliency of health facilities. So to be a great complement to that. And in fact, 2 of these projects, both in Quebec, are actually looking specifically at health system resiliency. One is looking at the vulnerability of health infrastructures, and the other at the capacity of the health system and facilities to prevent negative impacts of climate change on mental health. So again, I think the document's going to be very, very helpful. And in thinking about tool development, I think this information is going to be really helpful in supporting existing efforts in Canada to make health facilities, help them become more climate resilient. I think it was mentioned in the report, but the Canadian Coalition for Green Healthcare, they've actually developed a tool to help health facility officials assess whether they're climate resilient. And they've actually done some training and mentoring of health officials. And so again, I think this technical document is going to support those efforts. And there's going to be quite a bit of synergies and learnings that can be very useful. And then just in terms of mainstreaming climate change considerations into health facilities, I think that, again, it's going to be very useful. For example, when considering how to design, build, and locate new facilities, or how to upgrade or maintain existing ones. So one area that Health Canada is looking at in terms of opportunities for support with partners, the development of possibly new codes or standards for health facilities that would increase them in terms of being climate smart, to be able to protect patients, staff, and community members from growing climate risks. And then just the last area that I'll mention is just the usefulness of this report in terms of doing some research and analysis. And so currently we're developing our next national climate change and health assessment. And I'm really excited that we have a separate chapter on adaptation and health system resilience in that assessment. And so, as one of the leads for that chapter, I'm just very thankful to be able to have this report to reflect on and to be able to use. So it's perfect timing in terms of key research that we're doing. So I really think that the framework on climate resiliency and environmental sustainability of facilities, all of the case studies and the many risk management options that are in the report, and also importantly, the indicators that health officials can use are going to be a great help to all of these activities. And so again, just certainly appreciate having that report.
Thank you very much, Peter. It's very reassuring to hear from the first three speakers from countries as different as is Colombia, Ethiopia, and Canada. Everybody appreciates the difficulty that it is to put a document together that would be helpful to very different countries. So it's very reassuring to hear from the three of you that this definitely is. So I'm going to move now to the second question on communicating. And I'm going to call on Esther Patman and Antonella Rizzo. And the question is, what recommendations do you have for best practices regarding informing and communicating this work within and outside the health sector? So we can start with you, Esther.
Yeah, that's fine. Well, thank you most of all first for inviting me to participate in this document, in this discussion. We welcome this report because it really interlinks the importance of adaptation, so climate resilience and climate mitigation. I guess in the Netherlands we are in a bit of a lucky situation because climate mitigation and climate adaptation measures are addressed on a national level and it focuses on all the sectors. So the healthcare sector is one sector that is part of national programs and actions focused on climate adaptation and resilience. And this is important because most climate-related issues are cross-sectoral and need to be dealt with from a cross-sectoral manner, engaging the entire chain. Again, in the Netherlands, we are lucky that we have a climate law that aims at almost zero CO2 emissions by the end of 2050 and having a circular economy. And these plans also include a healthcare sector. So this really puts a communication framework for us in place. And also since 2018, we have a Green Deal Sustainable Healthcare, and that is predominantly aimed at greening the healthcare sector. Now, For a couple of examples, talking about, because the report refers to water and energy. If you look at energy, so my focus is predominantly on sustainability of the healthcare sector. So if a healthcare facility wants to change its energy supply and go to a choice of a full electric, so non-gas things, this choice is not only made by the healthcare facility, but it also implies the whole infrastructure around this healthcare facility. So if the hospital wants to switch, the whole infrastructure leading from the location where the energy is produced towards the healthcare, the locality of the hospital, plus the surrounding area, has to be comply with this demand. So also the other people using that area, facilities, businesses, or just inhabitants, need to collaborate in this issue. So once again, it requires like a close collaboration at a local government level, but also with the local community and with the supplier. And another example for water, if we, well, it's a bit from a perspective of a high-income country, but we have a program that specifically focuses on reducing medicinal products in water. And here again, we use like this cross-sectional chain approach, where we have all the partners collaborating at achieving this goal. And we started the development phase of medicinal products, and we go all the way through the use phase and the waste phase. So in this chain approach, pharmaceuticals companies contribute, healthcare facilities, production facilities, but also the waste phase, so the water treatment companies and the drinking water companies. So, and also, this is initiated by the Ministry of Environment, because it's predominantly an environmental issue. But our collaboration really broadens the scope of this program, because we have a lot of healthcare professionals and facilities that join this movement. And as I started, I'm really pleased with this guidance, because it really takes a look at the nexus between resilience and mitigation. And I think that for every country in the world, the COVID crisis has highlighted some flaws in the resilience of our healthcare sector, especially when we look at the use of disposable products. So I think every country in the world has experienced a shortage of some kind in this period, whether that be of medicinal products, of personal protective products, or just personnel capacity, so having enough nurses and doctors. And this crisis, therefore, opens up the opportunity to focus even more on the supply chain and on the sustainability of our supply chain. It exposed the vulnerability of our global supply chain and the on-demand system we have. And I think this experience helps us build the case for more circular practices in the healthcare sector by moving away from all these single-use products and going up to more multiple-use products. And in an ongoing study in the Netherlands, we are focused, it's a hotspot analysis, we are focusing on the major contributors of the environmental footprint of the healthcare sector. And it turns out that the production and transportation of goods that the healthcare sector uses, and they are mostly produced outside of the Netherlands and the EU, is a major contributor to our footprint. So this is a very good example where the benefits of a sustainable healthcare sector and a resilient healthcare sector coincide, because you are less, by using more reusable products, you are less vulnerable to hiccups in the supply chain, and it turns out that it reduces your footprint. So yeah, to sum it up, I think in order to really get this going, you have to have collaboration cross sectors. So the healthcare sector cannot do this alone. We need to collaborate with other sectors, also because they have the technological solutions, or they have experiences from other directions. And so, yeah, we need collaboration, but we have to keep in mind the special situation and the special position of the healthcare sector. So I would like to conclude it with that.
Thank you, Esther. Very interesting. And you put it very clearly what we try to say in the guides about addressing resilience and addressing environmental sustainability jointly, which is not easy, but it needs to be done because there's so many actions of one that complement the other and vice versa. So we do need to address them together, even if it sounds difficult. And sometimes we have to separate them artificially when they are not. In any case, to continue, I think, Antonella, you probably have some few ideas on communicating. Can you give us your ideas on this question, please? I think you managed to get in the system.
Yeah,
Are you there?
I was in a different room before, but I'm here. So, yeah, I want to agree with Esther and my predecessors today, and about communicating, like the importance of this work. As Dr. Neira said before, all of us here in this room today know that we need to change, and that change is different in different contexts and countries. In some countries, we need to guarantee access to safe water and energy, and energy supply that we can rely on. And in other countries and more developed countries, we need to start a deep mitigation path. And it's good to know that the Netherlands is already on that path, as the NHS is. And Diego from the Ministry of Health in Colombia mentioned that they are developing that adaptation plan, and it's going to include a mitigation component too for the healthcare sector. So that is a really good thing to know that is going on around the world. And in the recommendations for the best practices, sometimes it's hard to communicate outside the environmental health world, the relationship within this safe environment and health. Resilient healthcare sectors. I think this document is going to be a very good one to help healthcare workers and policy officers to understand the links between environmental protection and resiliency, and how that is an opportunity as well. It's like, as we are building for the future, when you make an investment in the healthcare sector, it's a very long-term one. So if you're building a new hospital, you should have different criteria right now to make it more resilient to climate, more effective in resource use, in the intents of the energy that is going to require. And as Esther said, there's a lot of opportunity in supply chain. We saw it this year, the problem that it was to get supplies when countries needed them. And that was an opportunity in healthcare without harm. We saw that around the world in members working in sustainable procurement that use that opportunity. In a way, it's not an opportunity, your crisis. You didn't have enough supplies. So that was an opportunity to prioritize reusable goods and reusable EPP when you could use those and you didn't need disposables. And that's an opportunity. I think the guidance, it's an opportunity to be able to communicate that in the sector, that we have a lot to review, and that is going to make us more resilient. And that is not that when you're trying to work on sustainability, that you're bringing a problem, that you're bringing some opportunities. And I think the guidance document is a good one. And to understand the risk and how to reduce your risk and how to reduce your own vulnerability when you're working with sustainability criteria. And one thing that, as Esther said, like healthcare sector needs to reduce its own environmental footprint almost everywhere, and mostly in more developed countries and environments. And they need to develop their own roadmaps too, to a national level. As Esther said, having a national policy, of course, helps a lot, making the case. And right now, like this year, we know our countries are developing their own long-term plans in climate, and they are reviewing and developing the national adaptation plan. So I think like we should work all together for every national adaptation plan for healthcare to have healthcare facilities included. And we know that that is not happening everywhere, and we could help with that. And I think that communicating that we have opportunities is good, and that we need to be creative because we don't have all the solutions yet. So, and we need to learn from each other. And for example, in Latin America, more than 100 healthcare facilities are reporting their carbon footprints and calculating those with a tool Healthcare Without Harm has developed. And they are using that in their sustainable procurement work to identify their priorities and to work with safer chemicals too. That is not carbon footprint, but they are working on that through sustainable procurement. So I think the guidance is a very good opportunity. Again, I'm saying that a lot, to help systematizing in a way and putting all the work that is going on around the world on safer chemicals, water supply, waste management, and climate resilience all together in one strategy.
Thanks so much, Antonella. I think you have some very important points. You made a very important point about investment, and it's something we're going to see it later on, about that it's not necessarily it is a good investment. It will pay back. It doesn't pay back immediately, but it does pay back. And of course, learning from each other, and I'm already learning so much from these discussions on how we have from very different countries and levels of income, but the problems are very similar. They are the same problems. Perhaps the scales are different. So let's move on to, once we have this guidance and we want to start implementing them in a country, so we start talking about piloting. And I'm going to ask Diego, Ashrafeddin, and again, Esther, to give us a brief comment on how should this piloting be conducted. What are your ideas about piloting the guidance in different settings? Go ahead, please. Let's start with Diego.
I fully agree with the Guide for Climate Resilient and Environmental Sustainable Health Facilities, and with the WHO Global Strategy on Health, Environment, and Climate Change as fundamental proposals for the fulfillment of the Paris Agreement and the Sustainable Development Goals. However, it's important to mention that climate change in Colombia, in Ministry of Health in Colombia, is managed from a subdirectorate in the ministry. Although we are in the process of working as a team with the other departments of the ministry. So the climate change component is under the responsibility of a single department of the Ministry of Health, and it is very common in other countries of Latin America. Therefore, I believe that the first to be pilot in our country, the first step can be to convince the decision makers, the minister and vice minister, of the need to carry out these actions in the country. And I believe that the WHO plays a fundamental role as facilitator to achieve this. Finally, it's important to involve the environmental sector and as far as possible other sectors like energy, transport, agriculture, to carry out this pilot, because this is the way the climate change management is planned in the country, in Colombia. And these sectors, they are also determining sectors in the proposed interventions. I have to say that for our part, we are willing to support in everything that is required to assess the possibility of carrying out a pilot in our country. And from this moment, we can ensure that the document, the guide, will be an input for the construction of the sector plan and the long-term strategy for the moment. Thank you.
Thank you, Diego. Yes. You raised an important
Yes,
question
yes,
there.
Carlos.
Yes.
Okay, so are you hearing me?
Microphones that are
Yes.
open. If you can close, yes.
Yeah, shall I
Thank you.
continue? Okay.
No, please. Let me. I thought you finished. You did not finish?
Yes, I finished.
Oh, yeah. Now,
Hi,
what I
Carlos.
wanted
I
to
think
say
this was
is that
who
you
was,
have reminded us that although when you think of the guidance, there are elements that any healthcare facility can say we want, and they can start doing small things. But you're quite right in that very often you need higher level decision makers, because not everything that you do you have control of. Like, for example, who's doing procurement? You don't do it comes from a central place, for example. So we need to work at different levels. There's a lot of things that the local healthcare facility can do, but there's things that they cannot do, and other levels would have to do it. But if we can move on to Ashrafuddin to get your views on
Yes.
piloting this.
Okay. Okay. Thank you, Dr. Carlos. So, as I already mentioned, we have a guiding criteria to make our health facilities climate resilient. So, to cascade this guiding, so we have a good option. Particularly, we have a good structure at the local level, because the ministry is erected its structure to the community level. The least health facility, which is health post. So we have a good structure, particularly in terms of manpower and management. So the only thing is we have to make this management aware and ready to make their commitment. The other is we have a coordination, which is we are working with different sectors and partners. Starting from Federal Ministry of Health and up to Regional Health Bureau, including at the health facility. This is the second good opportunity, the coordination. The other is even we have different initiatives. We have clean and safe health facilities initiative, which is what we are working with medical or clinical services to make our health facilities and clean and safe. This is the third good opportunities to make or select any health facility based on their fulfillment. The other maybe we have been conducted an assessment on the healthcare waste of health facilities previously. This can be used as a good starting point to select these facilities. Even we have to mix the facilities from different agroclimatic zones. So we have urban areas, we have rural areas, even we have a third, those is pastoral areas, which is different from the rural and the urban scenario. So these are one, we have to work on it. The other maybe we have to work on it with the leadership. When I say the leadership, we have to work on a top leadership, starting from the Ministry of Health. We have to get their commitment, whether in resource allocation, whether in supporting different working groups and encouraging these initiatives. So we have to get their commitment and their say on this document. So the other is maybe through involving sectors from top to lower levels, and even we have to involve work on partners working in these areas, so we can pilot and cascade this guidance. The other may be through mobilizing resources, through making health facility professionals alert and aware about the climate hazards and it is challenges which may affect the treatment activities itself. So based on that, we have to have a plan on how to cascade, on how to identify those facilities, and so how to implement and scale up to the bigger or larger facilities. So if we work on this, I think there are facilities which are so already ready to implement this or to pilot this guidance. So I think, as I already said, even we have already have the climate resilient healthcare facilities criteria. So it is a good opportunity for Ethiopia to pilot and to even scale up to the larger facilities.
Great. Thank you very much. So a lot of interesting challenges in working on the different social settings, geographic settings, subsectors, building the necessary partnerships. But we have a very positive outlook on that this is possible to be done to get started in Ethiopia. I would like to hear from you, Esther, again. Esther?
Yes, that's true. There's still some background noise. Could you please? Yeah. Okay, so what I think and our experience is that piloting is essential to push this issue forward. And there is no one-size-fits-all approach concerning sustainable healthcare. Moving towards becoming a sustainable and resilient healthcare facility is a journey. And I would like to use the analogy of a train journey. There are not all healthcare facilities start from the same point. You know, some start at a tiny station and they board a commuter train, while other healthcare facilities take a high-speed train from a major transport hub. So you really need to be able to provide options and action perspectives for all these different stages in the journey. And I think this guidance is set up in such a way that it really is also very people can enter at different levels. They can start doing things at different levels, and it also helps organizations benefit from each other experiences. So if I take a look at our experience we have in the Netherlands. In the Netherlands, the relationship between the government and the healthcare sector is mostly focused on responsibilities, authorizations, and mandate. So the role of the government, and especially of the Ministry of Health, is to create conditions that allow the healthcare sector to implement climate measures and to provide them action perspective. And we do this by using the Green Deal Sustainable Healthcare. And by now we have like 250 partners that have signed up to this Green Deal, and they all commit to greening the healthcare sector. Now what we do is we try to create and raise awareness by engaging healthcare sector managers and healthcare professionals. And we also request and stimulate the board of managers of health to make sustainability and also resilience, but that is covered in another part of our policy, but to make sustainability a part of their mission, vision, and strategy, so that it becomes incorporated in their everyday practice. And additionally, we facilitate the healthcare sector with knowledge and know-how, and we support this and we run various programs and pilot projects. So one of the examples of how we try to do this is for real estate. We have the ambition nationally to reduce the emission of healthcare real estate, and we have set up with our partners an expertise center on sustainable healthcare for real estate, and it provides knowledge and know-how and develops knowledge so how this can be achieved, and taking into account all the different types, sizes, and kinds of healthcare facilities we have. What we noticed is in sort of implementing these actions that highlighting the health benefits from climate mitigation measures is found very stimulating for healthcare professionals. So we try to shine a light not only on the benefits of sustainable practices, on focusing on the reduction of CO2 emissions and on monetary benefits, but we also try to get information on the healthcare benefits gained as a result of sustainable practices. And we try to do that with DALIs and QALYs. And that really taps into the intrinsic motivation of healthcare professionals to start working with this, because reducing CO2 emission in itself is not something that is their first and utmost motivation of the day. They want to, cure people, care for people. That's what makes them tick. So we not only facilitate with knowledge, but we also set up collaborations within the Netherlands for sharing good practices. We organize meetings between our participants to exchange their products, knowledge and experience. And we recently had an annual conference, which was attended by over 1,000 healthcare professionals within the Netherlands. So that was a really big group of people that are engaged into sustainable healthcare. And we also organize a competition, which is the greenest health profession. And the winner is awarded like a small fund to further progress a progressive idea or a pilot experiment to tackle a certain issue. We do a lot of communication to progress our plan. So we have a newsletter, we use various social media outlets, and they are open for everybody. I heard also a lot of talk about waste management and recycling. And of course, that's also one of the issues we focus on a lot. Because for a sustainable healthcare sector, good waste management and recycling is very important. And it also, if we have more reuse of products, it reduces the vulnerability of the healthcare sector. And again, here we have a cross-sectional and a chain approach is important. And I have one example I want to share with you just to make it more tangible for you all. We have one example of recycling blue wrap that is used in operating theaters. So if you aim to recycle this product to a product at an equal level of value, so not downcycle it to use it, for example, in car bumpers, but you want to use this material to make new blue wrap, so you stay on the same economic level of added value. You need to involve the whole chain, starting from the production and the purchasing of this material, because it has to be suitable for recycling. And it also, these, because you have to have, it has to contain the same kind of plastic. So again, these pilot experiments, what we notice, are essential to bring to light these interdependencies within the supply chain, in case you want to move to a circular economy. So it's a long way, but starting with these small pilots, which are sort of a framework of how this chain is interconnected to come from a single use to a circular chasing line, is really helpful. And I think it will also sort of benefit other countries, what you learn from these pilots.
Yeah, Esther, thanks so much. I really feel that I should have asked for an hour and a half for this session, because so many interesting and important ideas coming through. However, I'm conscious of the time, and we have 2 questions. So I want to move and ask the next speakers, my apologies first, but to be brief so that we can continue with the session. I know there are some hands being raised, but we're not taking questions in this session. Please keep your hands up for the next session that is coming soon. So the next question is about mainstreaming, and I'm going to call on Vera. What we want from you is, how should the guidance be scaled up and mainstreamed to support local healthcare facilities and communities? So sorry again, but see if we can be brief in the responses. Please go ahead, Vera.
Hi, thank you. First of all, we're from CEDA side very happy to see these guidelines coming out, and obviously from CEDA side, this has been a long-term investment into environment and sustainable climate solutions. So I'll try to keep myself very brief here in the interest of time. But I think throughout the conversations we have had earlier today as well, and from the other speakers, I think it's clear that one of the important things that we need to think about when we think about mainstreaming is really how can we look at global best practices. These are guidelines, but how do we do the implementation? And I think it's important to have a community where we can share global best practices, we can document these practices, we can translate these practices into different contexts and really sort of have that knowledge sharing. So I think that's one part of how we can mainstream and really sort of highlight the benefits both in terms of short-term outcomes and long-term outcomes. I think secondly, I would say it's really important to involve decision makers early on, and I mean decision makers both from the public and the private sector. I think it's important to remember that a large part of healthcare, especially in low and middle income countries, is provided by the private sector. So really early on involve decision makers, both within the healthcare industry and healthcare sector, but also beyond that, as I think it's been clear that this is important, and really to highlight again the benefits from these type of investments, which I think I'll talk more about in my second question. I think finally, just another point coming from sort of a donor perspective or from CEDA perspective is also we have been pushing for having sort of climate criteria into all of our support and investments, and I think that is essential as well, that like other organizations or bilateral or multilateral donors, I think it's also really important to be able to incorporate those criteria when we work with partners in different organizations throughout different countries, to be able to really sort of get these components and mainstream these areas of work. So I'll stop there in the interest of time, and I'll let Antonella continue.
Thanks very much, Vera. Antonella, very briefly, do you want to comment on this, please?
I think that we could use the guidance like recommends 5 steps, like first to create your team, baseline, create your plan, implement, monitor, learn from that. We can scale up that same approach to systems as we're going to see national systems testing, piloting this approach, and we are all going to learn from that. It's like at this same moment, countries strategies, and I think that there we have a great opportunity to scale up and mainstream this, to work with countries and in the climate cabinets in every place. Like health has a seat in the climate cabinets around the world, and this is a very good opportunity to include this type of approach into policy and to do the pilots and try to scale up like in these next few years. So it is included in the long-term strategies that are right now being developed and in the sectoral plans that are for 5 years and that are right now being written. So I think that's a good opportunity for the guidance to scale up and mainstream. As Diego said, they're going to use it to develop their own strategies. So I think we should all work to other countries to do the same.
Yeah. Excellent, thanks. Very good points. We're moving to the last question, and this is a double question because it is on financing and investment. And Peter had a suggestion for a different question, so I'm going to read the two of them. And the first one is for Vera, which is how can we promote investment in promoting climate resilience and environmental sustainability in healthcare facilities? And the variation for Peter is how can we facilitate collaborative action to promote climate resilience and environmental sustainability in healthcare facilities? So Peter, do you want to start with yours first?
Sure. Thanks so much, Carlos, for that. I guess, again, in the interest of time, maybe just I'll be brief. There's a couple of comments that I just wanted to make. So one is, I think one of the key ways to promote collaborative action is really to get the guidelines out there and get people using the guidelines and get that robust evidence that they need. So, for example, information on the growing costs of climate shocks and strains on health facilities. Perhaps some of the cost savings, quite often they're significant, and they can be realized in the short term. I think Antonella mentioned, thinking about investments in the longer term. And about the health co-benefits of environmental sustainable practices. So, we know that about 100 countries have done these broader climate change and health assessments, and they've used that evidence to a number of them to start undertaking health adaptation measures. And so I think really rolling out the guidance and getting some of this information will really promote sort of action. And I think ultimately can help with investments in the future. And then one other very quick comment. I thought the mention from Vera of global best practices was really quite helpful and really important. So, I think sharing the experiences of implementing the guidance with a wide range of users inside your country, but also internationally, is going to be extremely important in terms of promoting this activity. So, in Canada, we have large urban centers in terms of health systems, regional health authorities, but also remote and isolated rural. For example, in our north, and we have indigenous systems. And so there's a lot of different challenges, but a lot of opportunities. And so I think sharing those experiences can really promote the use of the guidance and all the different measures that we need to promote moving forward. Thank you.
Thanks, Peter. And I know that a lot of these comments that are coming out are going to be part of the next session, so don't despair. Vera, you have the last word about investment. How can we promote investment? What is your recommendations and ideas on this? Over to you.
Thank you so much. I would first say that I think there's so much to really highlight here in terms of promoting investment. This is not only something that is both long-term and short-term financially sustainable and efficient in terms of these investments. So I would say that I think it's important for donors or for organizations that may not have an enormous amount of money when it comes to investing in building actually health facilities. I think it's important to use those funds and support in a more strategic way. And that can be through catalytic funding that could really drive some initiatives that can have more larger effects. I think Sida has been part of financing initiatives like SHIP and other initiatives working on renewable energy for healthcare centers and so forth. So I think there's a lot of exciting ways to invest. I think catalytic funding or seed funding are interesting ways as well. And I think another important thing here is to really engage both government and private sector early on in these discussions to really sort of highlight what are the returns of investment here, what are the added value, both in terms of long term and short term. And I think it was mentioned earlier in this session that we might see the returns just in a very long time, and I would actually dispute that. I think you can see the returns on investment in a very short period of time. And I think we have to make the case for that because there's evidence to show so. So I think that is really, really important as well to highlight that. Secondly, I would say that there are a lot of interesting ways to actually support governments or support private sector to invest in more climate smart and resilient healthcare facilities. There has not been mentioned in this discussion, but I think as we see, a big private sector, I think public-private partnership or public-private people partnership is also something that is important to mention. That could be done through green bonds to sort of accelerate these type of developments. So I think that is another area where I think there's a lot of gains to be made, both in terms of, renewable energy, waste management, and water management, and so forth. So I will stop there, but there's a lot of really interesting way. I think it's just important to really sort of make the appealing case that it is actually to invest in this. And I think especially for low and low middle income countries that are mostly prone to climate change. So I think that's really, really important. Thank you.
Very nice final message. So it is a sound investment, and that's the message we need to bring to the countries and decision makers. Sorry, Marcelo, we ran a. It is excellent. Yeah. Elena, I'll give it back to you to introduce Marcelo. And we think the panel was really, really stimulating. Thank you very much.
Thanks so much, Carlos, for this excellent facilitation, and to all the panelists. I think we were all happily surprised by the good recommendations and experience that we heard from all of you. With this, I would like to invite Dr. Marcelo Corc, who is the Unit Chief of the Climate Change and Environmental Determinants of Health Unit in the Pan American Health Organization, to kindly facilitate the next session, which is an open discussion on priorities and next steps to strengthen resilience and environmental sustainability in healthcare facilities. Please, Marcelo, go ahead.
Gracias. Thank you, Elena. And it's a pleasure to be here with you this morning, afternoon, and evening. And it was an excellent panel. I'm sure there will be also a series of questions and comments. The dynamic will be if you can raise your hands, and I will give you the opportunity to have the platform and speak. So I see one hand by Tilak Siriwardana, and the microphone goes to you. So please go ahead. If not, we can continue raising other hands, please. Overall, in the meantime, just to give a summary, I know that my colleague Diarmid will do the same, but just for the sake of discussion, like Carlos mentioned, was an extremely rich discussion, really very broad, going from how general guidelines can be used, that can be also need to be context specific, as was mentioned by our colleague from Colombia. The difficulties that we encounter, as was mentioned in Ethiopia, the need for really have best practices and to share these best practices, and tool development that was mentioned by Peter from Canada, as well as communication issues, and what Antonella mentioned as well, how to do that, investment and issues with investments such as seed funds, catalytic funds, public-private, green bonds that Vera mentioned as well. As you can see, a very broad discussion. So I just bring to refresh your minds from all the different views that we had. So if you have any questions, please do not hesitate. I will go also to the chat room. You can, I see one by Hanafa that says investment in the PPPP, the public-private people partnership, is the key, especially the people. So I guess it goes in lines with what Vera was mentioning. Kigu Kefale also has the hand raised. Go ahead, the microphone is yours.
Okay, thank you, Carlos. And I have one question. I found the guiding very interesting and very workable. And as my colleague from Ethiopia, Sharafuddin, has concluded, we are in the process of doing on this climate resiliency activities. So this is a very important and supportive document. One question what I have is that this document focuses on the adaptation and some resiliency aspects, but not consider the mitigation that have. You hear me?
We can hear you.
We can hear you very well. Yes, go ahead.
Okay, thank you. So to consider that aspect, emission level of healthcare facilities, contribution to the carbon emission and other pollutant emissions, and carbon footprint has to be monitored and tracked. So to monitor that, some tools has to be developed and included. It was very good if that was included in this guiding document. So it enables practitioners to monitor their effects on their contribution to the carbon and other pollutant reduction. And it also helps to advocate for policymakers and other to initiate the carbon reduction. And the obvious thing is that the overall effect is health effect. The climate effect is ultimately a health effect. So health professionals are the advocates for climate change, as you know. So to advocate that, healthcare professionals has to information and evidence. So to generate that evidence, the carbon footprint reduction, if it is possible to monitor and track, the tools be added in this document. It was very good. Thank you.
Thank you very much, Igor. The question overall is about inclusion of a mitigation component. So if any of the panelists or from our team in WHO would like to talk about it, please go ahead to answer Hugh's comment.
I can answer if that's okay.
Sure. Go ahead, Antonella.
Yeah, I want to say, Hugo, that mitigation, it's not there as a component, that is true, but it's there transversal, I think. The document speaks many times about the need of increasing efficiency and the need of, and how mitigation is going to be a part of resilience, that there's no way of avoiding that. If you want to be a resilient healthcare system, if you want to adapt to climate change, we are going to need to work on mitigation, and when we work in sustainable procurement as well. So I think it's there, not as a component, but it is there around the document. You will see that.
Thank you, Antonella. And just to corroborate that, Alexander Hildebrand wrote as well that your group in Healthcare Without Harm has produced a report showing that the health sector's carbon footprint is significant, develop a tool to measure and reduce it. So it goes hand in hand with what, in a way, a little bit of we are trying all to work also with your group as well, Antonella. So thank you very much, Alexander, that you gave the spot also to Antonella for promotion of really the work that Healthcare Without Harm is doing. Any other comments or questions? I don't know if they want also other answers from the panel on that particular question. Don't be shy to ask. We still have about 15 minutes that we can, I'm sure that you would like to share with us as well, your interest on how can you really move ahead with the initiative on the use of the guidelines. For example, in the Americas, it's part of our action plan. So it's something that with the countries, and we were talking as well with Colombia in particular, it will be a specific country that we would like to do. And with Antonella, with Healthcare Without Harm, we probably would like to work together as well. But I'm sure that the countries have very rich experiences that they would like to see how to use the guideline. So the microphone is yours, folks. I can't believe that we have such a shy crowd, you know, I mean, it's unbelievable. I really cannot foresee that, but I'm sure that there is great interest.
Marcelo, if I may.
Absolutely, Elena, go ahead.
I just wanted to make a comment because I think across both webinars, the one that we organized this morning and this one, I think the nice thing that is, it has been made evident is that there are lots of things going on already, which basically give us a little bit of more relevance to strengthen this area of work. And I think that one comment also that for me is very important that has been made by Vera and by other panelists is just this need to make sure that the experience that is being already gathered is really shared and is really translated into something that can serve both to strengthen this guidance, but also to make sure that all countries with the different needs and their different contexts really can improve the work that they are doing, and we can all share and learn from that. I think that that's a very important point that I would like to maybe follow up with key partners and with you, just to make sure that this is really happening, because I think this will be key to really strengthen this area of work. So just wanted to raise this thought.
I think it's an excellent point, Elena. Thank you very much for the richness that you've been able to wear in the first section as well, to compare both sessions. I think that that's very enriching experience, as well as, yes, definitely one guiding issue that we've heard from many of the panelists is the sharing of experiences, sharing practices in different settings. And I think that that will be something that we can really look forward to work together with the countries on that. There is a comment by Yassine on why the title is healthcare facilities and not health system. I think that really is a very short question, but very profound question as well. And really, I would like to hear from any of the panelists that they would like to go ahead and pitch an answer on that one. So whoever would like to go ahead, from the panel, please go ahead.
Well, as our experiences, we look at it more as healthcare systems, because there's healthcare being delivered in facilities, but there's also a lot of healthcare which is not located to a facility, but it's also a whole system with products that being purchased and products delivered. So focusing on healthcare facilities sort of gives it a locality, while it's more holistic, the healthcare system. So if you really want to make a big step, I think healthcare systems is more, you take more on board, you will be more successful.
And Esther, if you allow me for that, an extra point, can you, or if there is, because some colleagues also mentioned difference between health system and health sector. And there is a discussion also how to put it together. Do you have any comment on that as well, since you started the dialogue? And then, Vera, I think that you would like to add something as well, right?
That's a difficult question, the difference between health sector and health system. Yeah, for me, they're almost equal. I'm sorry to say. So the health sector and the health system, yeah.
We can quote you later, so it's not up to us, you know.
It was for me, huh? So...
Go ahead. Vera, please go ahead with your comment as well.
Yeah, thank you. No, I think not to get too much into semantics, but I think the important here is that health facilities, whether that is we consider a health facility with their surrounding organizations as procurement and purchasing and so forth, one would consider that part of the health facility in a sense, and other might see it as outside. But I think they are heavy consumers of a lot of different materials and resources and so forth. So I think the good thing about this guidance is that it actually does focus in on health facilities and gives a sort of more practical toolbook to governments and organizations who are either in the construction or the upgrading or renovation or reconstruction of their healthcare facilities. And I think, having seen a lot of different governments that really face these type of challenges in terms of climate change, I think this will be something that they really look forward to. I think it doesn't mean that we can't expand the concept in a later sort of guidance or broaden it, but I think this gives us a sort of a hands-on set of tools to work with, and I think that that has its purpose.
Great. Thank you very much, Vera, for your comments. We have a hand raised by Terence. Terence, please go ahead. The microphone is yours. Terence Thompson.
Hello?
Yes, go ahead, Terence.
Okay, sorry, my microphone was muted. I just wanted to share briefly some of my experience using this guidance document already, because I was using the draft version of this some time ago to assist the Fiji Ministry of Health to develop a national guideline on climate resilient and environmentally sustainable healthcare facilities. And of course, we aligned it to this WHO guidance document, which Carlos was developing at the time. So the global guidance document has very extensive, checklist items of things to consider when we're looking at the various interventions, healthcare workers, WASH, energy, infrastructure, and so forth. And of course, not all of those checklist items are applicable to every country. So we had a participatory process working with the Ministry of Health colleagues, to sort of select from those checklists which items were relevant to a small island developing state like Fiji. So we came up with some national guidelines, but in the process we realized, well, even a national guideline is not applicable to every level of healthcare facilities. A central level hospital is very different from a rural health post. And even you have healthcare delivery at a level lower than the rural health post in visiting nurses who work from their home or community health volunteers who work from their home. They also have to be resilient to climate change. And they also have environmental issues. They generate waste and so forth. So that is going to be the next step in working with Fiji. We have now a draft national guideline, which is based on or aligned to this global guidance document. But the next step then is going to be adapting the national guideline and making it applicable at various levels of healthcare delivery. And we will be able to share that experience, I think, sometime later this year or early next year. So I just wanted to share that experience with everyone.
Thank you, Terence, and thank you for starting sharing experiences on the use of previous version of these guidelines in a place like Fiji with its own characteristics, and definitely very enriching also for other seats as well. So thank you very much for giving us your input on your own experience. Linda wrote us that regarding PPP, one of the issues we have experienced in Canada is that the PPP contracts need to be really well thought out so that continual improvement, adaptation, resilience, and mitigation are all possible within the original contracts. This has been seen as a problem here that needs to be addressed. Thank you very much for that comment. Then Alexander also wrote, you may wish to look at the WHO operational framework for building climate resilience health systems that already are in place. Rohit also has a question. A very important guidance document as a very up time. as you are kindly aware that the world is going through a grim situation of COVID-19 global health crisis, and the world is facing huge pressure on the healthcare facilities. Developing countries are more vulnerable to this pandemic as they have comparatively less developed healthcare systems. And this pandemic have economic implications as well on their economy. How do you see the challenge of climate financing in health sector would be addressed in developing countries? Will WHO act as a catalyst to bridge this challenge of climate financing in developing countries? I think it's a very important question, especially for developing countries in these times of crisis and uncertainties. So I give the room to either panelists of my colleagues at WHO that would like to answer that specific question. Go ahead. Anybody that can address that particular question? Any of the panelists that will feel, I don't know if, I don't want to put anybody on the spot. I mean, we're talking about a very sensitive issue. It's financing. And I think that it demands a lot of thought. I think that the ideas that they were put in the questions, they're very good. I don't think that they are all totally thought out at this point. I think that Vera mentioned different points, but definitely within the current situation that we are living with COVID-19, we need to figure out very closely how to prioritize in developing countries to move forward on that. And I think that that really will demand lots of thought. And at this time's uncertainty. I don't know if Vera, you would like to add something since you come from the developing agencies communities, how you will envision or a possibility for that to move forward in these times of uncertainties.
Yeah, thank you. I think there's definitely, I mean, it is a tricky situation, obviously, that we are in right now, and it has put a lot of financial strains on already very strained healthcare systems. But I think also what this crisis has showed us, in a sense, is that there is funding, and there's and we have to be aware that we have to put funding in a very sustainable way, in a long-term sustainable way, and I think if I understood the question right there, I think investing in climate resilient and environmentally sustainable healthcare solutions is not something that should be seen as a priority. I think we all know that climate change is affecting people, especially low-income countries already, and mostly people in low-income countries. So I think that is really of the essence to see it as an urgency to really start investing in this and investing smarter. So I'm not sure I quite answered the question, but hopefully I brought some light to it.
Oh, absolutely. I think that at least it's the time to bring light. I think that we are still living in times of uncertainty, and I think that will clear up along the way. Even though they're challenging, there are still opportunities. Now, given the time, I think that it's we are within the time, a few minutes late. But I'm sorry, Diarmid, that I took over a few minutes from your session. But now I will pass the microphone to my colleague Diarmid to give the final words and to the path forward for the use of this guidance. Go ahead, Diarmid.
Thanks. Thank you very much, Marcelo, and no problem at all with taking a couple of minutes. No, I think that the discussion part, the panel discussion, and the questions from the participants are always the most important and interesting part of this kind of session, and particularly when we're launching a document. And this is exactly the purpose of this, is to have a discussion and to start to get the first feedback from partners who have been involved in developing it, and also that the community that we hope will take this forward. I'm hopefully going to be briefer than the 10 minutes that I have left, but it has been an extremely rich discussion, which I'm going to have trouble summarizing, and I'll also try and get across a couple of the points that we got from the session that we ran this morning, our time, to hit a different time zone in the world. But I'll just show you, I have sort of pages of notes of interventions that I'm going to try and sum up into just a few key points. But I think that there have been some coherent themes that have come through the discussion in this session, but also in the previous one. I think we always recognize that we have a bit of a challenge in the scope of any guidance that we try to put out in this field, because climate change is connected to everything, health is connected to everything, and we could talk about healthcare facilities or healthcare systems or health systems. And what we've been trying to do is to try and make this as tractable as possible and as practical as possible. And the main target audience that we think we have is the person primarily within the Ministry of Health who has been tasked, usually by the minister, to say, what are you going to do about climate change? WHO and other partners have told us it's a problem. They've told us it's a threat for health. We can start to see the impacts in our communities. Make us a plan to sort this out. And in order to do that, as I said earlier on, we do talk about the overall health system approach of building resilience. And as I think it was Esther was making the point, that doing this job is actually a multi-sectoral job. It goes beyond the direct control of the health ministry, health system, and so on. It relates to the determinants of where you get supplies from, or the determinants of health. But we're trying to make this as practical as possible. And we know that there is demand for people who want to look at the healthcare system and healthcare facilities and talk practically about what they can do within them. I also thought it was a very useful discussion, again, on the scope about mitigation versus adaptation, or mitigation and adaptation. And we have tried to cover both of those. It was interesting for me to hear participants from relatively low-income countries saying that they're interested in mitigation within healthcare facilities. I think that's really important and useful feedback to us, because we also get the message from some constituents, effectively to say, don't talk to us about greening the healthcare sector in Ghana, because we don't even have energy in many of our healthcare facilities. We need to ensure the basic services, ensure they're resilient to climate risks. And we have basically tried to accommodate this to say, we understand that your most urgent problem is the basic services and ensuring they're resilient. But by the way, there are many things that you can do which will actually improve those services and will also have a lower environmental footprint. So we've tried to cover the whole scope, but in a constructive way. I think, again, on the scope, I think it's been really useful to have the feedback that there is relevance of this approach and of this guidance in countries across the income spectrum. But it was also really useful feedback that even within Fiji or within Canada, there are great variations. So I think we've done the right thing in trying to lay out the general scope, and then trying to support the countries after this to make it relevant for their different target audiences. I don't think ever from WHO and our partners on this, we would ever be able to produce tailored guidance for each individual audience. I think the best way to do it is to put out the general approach and to work with you in tailoring. And finally, on the issue of scope, it was really interesting and useful to hear the various countries talking about their own national processes that they have going on, whether it's their nationally determined contributions to the UNFCCC or the health adaptation work in Canada, because we know we're now at the stage where countries around the world are already working in this area. We're not trying to ride over the top of that. We're trying to provide a general approach that can support it and also support lesson learning between countries. So that was my first point on the overall scope. The second is on the sequencing and how we can continue to scale this up. And again, I think we've got really good feedback that it is important that we pilot this approach, or that countries build it into their own piloting, and then we try and build it up and also share experiences across countries as we're doing this. Because I think it's also been fascinating to hear that as we try and take this forward, it's important to relate it to the current business of health professionals and health systems. And there were really good connections that were made to the COVID crisis, even the extent to which that promoting this kind of approach can actually, in some ways, improve our response to or help cope with the additional strains that COVID is placing on us, whether it's difficulties in the supply chain or in managing the amount of healthcare waste that is being produced, for example, because the whole industry is getting through lots of PPE and lots of masks and so on. Having the sustainability mentality in place is going to help us with that. So I think we need to build this up from the piloting approach to eventually getting it to the stage where it's mainstream. And I think our colleagues, particularly in the Netherlands, but also increasingly elsewhere, sound like they're at that stage where this is actually now core business. That the question is no longer asked, why do you need to promote sustainability within health systems? It's accepted that it should be done. And that's the kind of approach that we're trying to promote across the world. Two more points. The next one is on funding. And I think, again, this was a really useful discussion, that there is a role for donors in this, because we know that particularly in low and middle income countries, but around the world, health systems, healthcare facilities, any level, they're already under stress. So it's not easy just to come up with to come up with money and to solve all of these problems. But I have to say, I was also encouraged by the feedback, I think, from Ethiopia, where they were saying, well, we have the capacity in place, we have the human resources in place. The kind of thing that we need is coordination, and we need the mandate, and we need the guidance in order to make this mainstream. So it's not always all about the money. The countries often have a lot more resources than sometimes we assume they have. But having said that, early money particularly is important, and I think that this point was made from the colleague from CEDA, that there is certainly a role for bilateral funders or the Green Climate Fund, for example, in putting money into piloting and putting money into sort of priming the system and establishing the approaches. And at this point, I have to point out that there is a neglect from the multilateral climate finance system, but basically less than 1% of global climate finance has currently gone to health resilience or health in any form. So more does need to be done there to get this thing started. But also the point that was made that often, sometimes we say, and we said in the other discussion, that there are heavy costs up front to doing this, but the benefits pay back over time. And in fact, it was really useful feedback in this discussion that sometimes the benefits are immediate. Sometimes the benefits immediately accrue in the short term. And so we should be taking those low-hanging fruit, investing in those things which we can identify, which will immediately save money, improve delivery, increase resilience, and reduce the emissions over the long term. But at the same time, we do recognise that the greater investment needs to come in. WHO is committed to playing that role. We lobby with the Green Climate Fund and so on. But I think perhaps the more important point is that we need to make this mainstream and part of the regulation and the conditions that go into investment in healthcare facilities or health systems. That it is just taken as standard that you would not put an investment into a healthcare facility unless you had satisfied yourself that it was climate resilient and that it reduces environmental footprint. That should just be core business from now on. So we need to look at funding streams, we need to look at green bonds and so on, but we also just need to make it part of the regulation that this is the standard that now needs to apply. So that was the third of my points, and the final one, which came through strongly this morning, but also referenced several times today, is just the importance of people within all of this. I was quite struck by the comment that talked about PPPI. So investments in where I come from, there's a lot of talk of public-private investment, including within the health system, but saying, well, it's actually people's engagement, people's support is critically important. That was also the point that I was making in saying just how important and trusted the health community is on this issue. I think if there was one message that we would like to take forward, is that it's critically important that the health workers, the health community, identifies with this and sees themselves within it, both because that's the only way this approach is going to work, but it's also the way in which we will have the impact on wider society. And so I'll just say that the final point that I'd like to refer to on that point is that we were hearing in the other session this morning, people were asking, what is the role of medical education in all of this? How much training of healthcare professionals takes into account climate change? And part of the discussion said, well, it sort of needs to nowadays, because young people are demanding that people who are interested in healthcare will be asking, what are you doing about environmental sustainability? Of course, their first job is protecting people's lives, but it is now so important to protect the environment as well. And they see that's the direct connection to people is really important on that line. And then I think the final insight that I took out of this was from the example from Terry Thompson, which was saying that in Fiji you can talk about different levels of healthcare facility, but it even goes below that, and it actually goes down to the rural health worker who doesn't even have a facility, but they're the real frontline defense against climate change. And I thought that was something that we hadn't even thought of. That even the people that are delivering the services outside of the healthcare facilities need to be engaged with this, need to be trained, need to basically take it as part of their mission as well. So with that, in fact, I've just realized my summary took a minute longer than I was supposed to have allowed myself. But I think from my point of view, again, it's been an absolutely fascinating discussion. When we launch these documents, sometimes we can think of them as quite dry technical documents. But I think this webinar, or this pair of webinars, has proved that it's really just an entry point to a much more interesting and wider discussion about promoting climate resilience and environmental sustainability, I would say, throughout the health community. So with that, I'll just take the opportunity to thank the team here, and Elena and team, and Carlos, who have been instrumental in putting the document together, including Healthcare Without Harm, who contributed a lot of material as well. So I'd like to thank them, Annika and colleagues for organising the webinar, my colleagues at PAHO for also helping to run this and to run the discussion. But the particular thanks to the panelists for a really, I think, fascinating, insightful discussion, and then finally to all of those, all of you who have tuned in and participated in this discussion. And we will absolutely carry this on, and we will be in touch. I'll open the floor if anybody wants to make any final remarks, any final contributions. If not, then I'll bang the gavel, declare the meeting closed, and thank you, and look forward to interacting with you in the future. Thank you very much.
Thank you.
Thank you.
Thank you very much.
Thank you very much.
Thank you.
Thank you. Thank you. Bye-bye.